The Department of Global Health Initiatives, headed by Gillian Gibbs and teamed by Danielle Hormillosa and Karen Kilberg, are here to talk to us about some such initiatives.
Hello, Lions, and welcome to the session on Global Health Initiatives. My name is Gillian Gibbs, and I'm the Manager of Global Health Initiatives Department for LCIF. I am joined today by two colleagues, Danielle Hormillosa and Karen Kilberg. We are so honored to be here and to be a part of the Isame virtual forum. We only wish we could have met in person. So today, we are going to provide you with an overview of our grant programs. First, Danielle will start with diabetes, and she will provide you with information on what diabetes grants fund, as well as some best practices on how to complete a successful application. And she will highlight some projects in Isame that are currently undergoing a successful implementation. Next, Karen will present on the Site First program. Similarly, she will present an overview of what is funded, how to apply, and successful projects in Isame. They will also give a high-level overview of the grants management process and highlight some resources and contact information for Lions interested in applying for these grants. Thank you, and I will pass the presentation over to Danielle Hormillosa.
Hello everyone, my name is Danielle Hormillosa and I serve as the Regional Program Specialist for South Asia for the Global Health Initiatives Department at LCIF. I wish that we could be together in person, but I am excited to join you today in this virtual platform. As a way to support Lions who want to expand their service and increase their impact in the diabetes cause area, LCIF offers diabetes grants. I'm pleased to tell you more about this program today. Before we dig into the details of the program, I would like to share with you a few highlights. The diabetes grant application was first launched in July of 2018. Since the first grants were approved in January 2019, LCIF has awarded over 70 grants to over 30 unique countries for a total of about $5 million. In the Isame region, a total of 16 diabetes grants have been awarded for a total of over $1.3 million to diabetes projects in India, Sri Lanka, Nepal, Lebanon, and Palestine. So, what types of projects are eligible for a diabetes grant? LCIF diabetes grants provide support in 4 specific intervention areas. The first I'd like to mention are youth symposiums and retreats that encourage interaction and education among peers in a positive, medically safe environment. These can range from short-term day sessions to week-long retreats that promote diabetes self-management and lifestyle changes. I'd also like to share some examples of eligible and ineligible project expenses. An example of an eligible project expense are medical personnel per diems to provide support during a diabetes retreat. Individual sponsorship for children to attend a diabetes retreat is not an eligible project expense. Another intervention area is human resource training to establish or expand professional-level medical expertise and/or train community diabetes educators. An example of an eligible project expense in this area is tuition and fees to train individuals as certified diabetes educators. Salaries for newly trained professionals is an example of a project expense that is not eligible. Diabetes grants also fund infrastructure development to improve diabetes healthcare access through renovation of diabetes care facilities, as well as the provision of equipment. Renovation for spatial improvement and upgrades for an existing diabetes care facility is an example of an eligible project expense. An example of a project expense that is not eligible is construction and establishment of a new diabetes care facility. And the final intervention is community screening activities organized in partnership with healthcare professionals that are designed to identify at-risk individuals. Screening activities must ensure there is a follow-up care protocol in place. Examples of eligible project expenses include screening consumables, such as glucometers, for a diabetes screening event, individual assistance for people living with diabetes, including continuous glucose monitors, strips, and insulin, is an example of an ineligible project expense. Eligible and ineligible expenses are outlined in detail in the diabetes grant application, as well as the diabetes grant reference guide. Both these resources can be found on our website. Now, let's go over some key criteria for diabetes grants. Funding is available between $10,000 US and $150,000 US for districts, and up to $250,000 US for multiple districts. LCIF matches up to 75% of the total project budget, which means that Lions are responsible for at least 25% in local matching funds. The matching funds must be contributed as cash. While in-kind donations do not count towards the match, they can still strengthen your request. As part of the application review, we strongly suggest that Lions applying for LCIF diabetes grants show proof of having collected a portion of their matching funds before the application is presented to the Board of Trustees. When developing your application, please include a detailed plan for fundraising and a timeline of when all matching funds will be collected. Grants are reviewed in August, January, and May during LCIF Board of Trustees meetings. The deadline to submit applications is 90 days before those meetings. However, the review process can take some time depending on the development of the grant application. So, the earlier you submit an application, the better it is to avoid delays. At any given time, only 2 diabetes grants can be open for a single district, and 1 diabetes grant can be open for a multiple district. Having an open diabetes grant does not affect a district or multiple districts' ability to apply for other grant programs, so long as the active diabetes grant is in good standing. Additionally, grants must be submitted by the local Lions district or multiple district. Lions must also be the recipient of the grant award. Healthcare or community organizations are not eligible to apply for a grant without the involvement of Lions. I would also like to add that the grant application is available as a PDF version as well as a Microsoft Word version. For your convenience, you may type in your answers directly into the Word document. I encourage everyone to submit their grant applications electronically by email. The application review process includes an evaluation by both LCIF staff and a technical advisor who is a diabetes expert. During the review process, we evaluate applications on 3 primary factors: impact, efficiency, and sustainability. Strong diabetes projects are planned by Lions in collaboration with partners such as local diabetes organizations or clinics. Strong projects are needs-based and exhibit cost-effectiveness, as well as include a plan for sustainability beyond the lifetime of the grant. Also consider what other diabetes services already exist in your project area. What value does your project add to the community in terms of fighting diabetes? The technical advisor is available at the early stages of grant development if you have questions or need help. And regional program specialists like me are also available to walk through the early stages of project planning and the application process. Now, let's take a closer look at some best practices when developing a diabetes project proposal. Equipment is often requested for a diabetes center adjacent to or inside a multi-specialty clinic or hospital. In cases like this, please consider whether similar equipment is already available in your clinic or hospital, and whether the requested items are to be used specifically for people with diabetes. Here are some things to remember when requesting equipment funded through the LCIF Diabetes Grant Program. Requested equipment must be used specifically for the clinical care of people with diabetes. All equipment requests must include a detailed justification explaining why it is needed for the project. Please keep in mind that equipment requested from LCIF should be cost-effective, not necessarily state-of-the-art or high-tech equipment. We also encourage procuring equipment from local suppliers. Equipment requests must be based on the specific needs of your project area. Provide multiple price quotations or pro forma invoices to justify the most cost-effective option. To better assess the utility and purpose of your request, please include the device and model specifications for each equipment. Diabetes grants do not fund equipment used outside the scope of a typical diabetes clinical care setting. Therefore, equipment for research, dialysis, biochemical analysis, or advanced cardiac care are not eligible. Here are some tips for success when planning diabetes screening activities. Screening initiatives funded through the LCIF Diabetes Grant Program must target at-risk communities or individuals and provide comprehensive follow-up care by qualified medical professionals. The use of a paper or computer-based risk assessment test is an important first step to determine who needs a blood glucose test as part of your diabetes screening process. Two diabetes risk assessment tests commonly used are the Finnish Diabetes Risk Score, or FIND-RISK, and the Indian Diabetes Risk Score, IDRS. Both are shown on this slide. Screening initiatives funded through the LCIF Diabetes Grant Program must specify the output indicators used to monitor the project's success. Examples include the number of people screened for diabetes, the number of people referred to medical professionals for additional testing, and also the number of people with confirmed pre-diabetes and diabetes who are referred to healthcare programs for prevention, management, and control. Strong diabetes projects detail the barriers that would prevent a person from getting the follow-up care he or she needs. How will your project address these barriers? What is your plan for patients who are unable to travel to the hospital and/or cannot afford to pay for treatment? And last but not the least, we understand that due to COVID-19, screening and outreach activities are a challenge given the limitations on mass gatherings and travel. While the pandemic continues, we encourage you to rethink traditional outreach strategies and focus on other ways to conduct screenings within your local public health and safety guidelines. In the past months, the Lions have demonstrated creativity and resourcefulness in providing diabetes services to their community despite COVID-19. Some of the ways Lions have adapted their project plans include organizing online diabetes risk assessment campaigns and virtual education sessions, conducting diabetes screenings in local doctors' clinics rather than in larger venues, and using electronic methods like mobile text messaging and WhatsApp to communicate with patients. Diabetes education and public awareness initiatives do not fall neatly into the 4 intervention areas of diabetes grants. but it can be included as part of your grant request as a supplemental activity. Some examples include conducting a screening event that also includes an education program for diabetes prevention and management, establishing groups of individuals with diabetes or prediabetes who receive education on lifestyle modifications and diabetes self-management as part of their follow-up care plan, training Lions to become certified diabetes educators in addition to human resource training of healthcare professionals. In light of COVID-19, we again encourage you to rethink traditional education strategies and focus on other ways to educate your target audience within local public health and safety guidelines. Some examples include conducting virtual learning opportunities or small batch educational sessions that ensure social distancing. Now, I'd like to share some diabetes grant projects. The Lions of Kerala in India have partnered with the local Amrita Institute of Medical Sciences and the National Health Mission to help people with diabetes prevent and manage complications such as diabetic retinopathy. The grant covers 2 of the 4 intervention areas, screening and human resource training. The project trains community health workers and Lion volunteers to conduct community field screening for diabetes and refer those at risk to government primary health centers. Lions were trained on diabetes complications and how to deliver general diabetes information to people at screening events. Community health workers were trained on using handheld equipment and performing the India Diabetes Risk Assessment. Patients at highest risk and most need of services are referred to the Lions Diabetes Screening Events, where a 40-member medical team from Amrita Hospital conducts patient education and counseling, as well as a medical screening and services for complications of diabetes. The approved targets for this project include screening and educating 150,000 individuals at home by community health workers, organizing 360 diabetes screening events, and achieving a patient adherence rate of 70% for referral appointments. Thus far, diabetic retinopathy has been detected in 34% of the people screened and neuropathy in 47%, revealing the immense magnitude of the diabetes problem in Kerala. In this second grant project, the Lions of Nepal seek to upgrade diabetes care services with an emphasis on diabetes management, diabetic foot care, and detection of diabetic retinopathy at the Dhulikhel Hospital Lions Diabetes Center, as well as its 17 outreach centers and in 5 local municipalities. The grant covers 3 intervention areas: infrastructure development, screening, and human resource training. The approved targets for this 3-year project include equipping the hospital with diabetic foot equipment, providing diabetic foot care to 1,200 patients, human resource training for 1 doctor in endocrinology and 4 nurses in diabetes care, organizing 504 screening events and screening 64,080 individuals, and managing diabetes in 1,000 patients annually at the hospital and its 17 outreach centers. The Lions began conducting screening activities in February of this year, but temporarily paused from March to July and from August to September because of nationwide lockdowns that were in effect due to COVID-19. Despite the changes in their project timeline, the Lions are diligently working to procure equipment and initiate human resource training. This project from Lebanon has not yet started since it was approved just at the start of the COVID-19 pandemic. However, it is a very comprehensive project that should result in a large impact for the north of Lebanon. This grant covers 3 of the 4 diabetes intervention areas: infrastructure development, training, and screening. The approved outputs for this 2-year project include equipping a diabetes education room at a hospital in northern Lebanon, training 15 physicians and 18 nurses on diabetes prevention, education, and management, screening 3,000 individuals for diabetes at 10 screening events, and having at least 70% of all referred individuals comply with the referral, organizing 20 education and awareness events, and enrolling 300 individuals living with diabetes in 30 support groups. That concludes our discussion about the LCIF Diabetes Grant Program. I would now like to turn it over to my colleague Karen Kilberg to discuss the SiteFirst Grant Program, as well as the grant management and reporting processes for both SiteFirst and diabetes grants. I thank you all for your time and have a wonderful rest of your day.
SiteFirst, Lion's Vision for All, has been a game changer in India in terms of infrastructure development, equipment, and the training program.
LCIF has helped Lions to establish and operate more than 200 eye hospitals and clinics in India,
7.
and has invested in training thousands of eye care professionals.
We put up this institute to provide affordable eye care to average citizen of our society. People who can't afford, we give them absolute free care. Mobile units go to the villages, identify people who need surgery, bring them to our Lions Base Hospital.
ಇವಾಗ 3 ತಿಂಗಳಿಂದ ಫುಲ್ಲು ಕಾಣಿಸ್ತಾ ಇರಲಿಲ್ಲ.
We have a lot of partnerships who come forward to support our activities. Eye care plays a great role in the economic development of a country or a state.
ತುಂಬ ಟ್ಯಾಂಕ್ಸ್ ಅಂತ ಹೇಳ್ತೀನಿ, ಎಲ್ಲ ಚೆಂದಾಗಿ ಮಾಡಿದ್ದಕ್ಕೆ ತುಂಬ ಟ್ಯಾಂಕ್ಸ್ ಅಂತ.
So more people are healthy, they are not a burden to anybody else, they are able to do their own work. The Lions' commitment to gift of sight is unparalleled to any other NGO in the world.
Thank you.
That is why the best thing for any corporate or CSR partnership is to trust the Lions, because we know how to economize our gift of eyesight.
Hi everyone, my name is Karen Kilberg and I serve as the Regional Program Specialist for Constitutional Area 8 and the Middle East for the Global Health Initiatives Department. LCIF offers SiteFirst grants as a way to support Lions who want to expand their service and increase their impact in the vision cause area. I'm very excited to tell you more about that program today. Before I discuss the details of the program, I would like to share with you a few highlights of the impact of the SiteFirst grant program to date. The SiteFirst grant program was launched in 1990 and we are celebrating its 30th anniversary this year, so hopefully you've been able to follow along with the celebration. The program launched a new grant application in 2018 and we now require that all new applications are submitted following this new template. Since 1990, over 1,330 SiteFirst grants have been approved for over $356 million for over 102 countries. With those numbers, you can imagine the enormous impact the program has made worldwide to date. SiteFirst grants fund 3 intervention areas which are displayed on your screen. These are infrastructure development, human resource training, and service delivery. Through the infrastructure development intervention area, SiteFirst grants can help expand access to eye care services through renovation of existing facilities as well as provision of equipment. An example of an eligible project expense is renovation or expansion or provision of supplemental equipment for existing eye care facilities. Example of ineligible expenses include the construction of new eye care facilities, a grant for only replacement equipment, or the construction of an eye bank. Through the human resource training intervention area, SiteFirst grants can help improve the range and quality of eye care services provided. An example of some eligible project expenses are the training or retraining of ophthalmic staff, equipment maintenance technicians, and sometimes hospital administrators and project management teams. Some examples of ineligible project expenses are one-off scholarships and any type of salaries. The final intervention area, service delivery, is typically a byproduct of the first two intervention areas. Improvements in the quality and access to eye care services can happen from the new equipment, expanded infrastructure, and human resource capacity. So many times you may not request any funds for this intervention area. You can view it more as a byproduct or outcome of the other two. An example of an instance where you would request funds for service delivery would be for outreach screening campaigns. However, these are now discouraged to be included in new SiteFirst grant applications given the persistence of the COVID-19 pandemic and due to restrictions related to the containment of the pandemic. Therefore, you should view this as a result of the or output of the project rather than an intervention area for which you seek funding. Examples of some ineligible project expenses are cataract subsidies and any other form of direct support to patients. Ineligible and eligible expenses are all detailed in the SiteFirst grant application, which can be found on our website. Now let's go over some key criteria for SiteFirst grants. There is no minimum or maximum budget requirements for SiteFirst grants, and this makes this a little bit different than other LCIF grant programs. While we do not have minimum grant requirements, grants must exceed the local fundraising capacity of the district. Therefore, most grants are above $20,000 US. In terms of maximum amounts, all budgets are evaluated for their cost effectiveness. LCIF staff will recommend cuts if we do not believe the project is cost effective. Therefore, furthermore, the SiteFirst grant program has a $10 million approval ceiling per Alliance year. For this reason, high-cost projects are highly scrutinized. There is no general matching fund requirement for SiteFirst grants. However, requests for EQ plus equipment are subjected to a 50% local match, which can be raised by Alliance, hospitals, or partners. EQ plus equipment refers to all high-tech, high-cost equipment, including all lasers, wet labs, visual field analyzers, optical coherence tomographies, and any other specialty equipment. There are other criteria that are required to be met in order to request this equipment in your application. This criteria can be found in the EQ Plus policy, which is posted on our website and is also linked in the SiteFirst grant application. SiteFirst grants are only reviewed in August and January. The due date for applications is 90 days before the given SiteFirst Advisory Committee meeting. The exact dates each meeting are posted on our website. However, due to the lengthy review process, LCIF staff always recommends and encourages submission of applications before this deadline. We accept applications on a rolling basis, so never hesitate to send your application to us regardless of the time of year. While there is no limit to the number of open and active SiteFirst grants that can be awarded for a given district or multiple district, we do assess the number of grants open in the district when considering new applications. Furthermore, the status of those open grants is also considered. Any delinquent reports from other grants in the district will be considered by SiteFirst staff or by Global Health Initiative staff during the review of these new applications. The application review process includes an evaluation by LCIF staff, such as Danielle and I, the Regional SiteFirst Technical Advisor, and the SAC Secretariat who works at the WHO. During the review process, we evaluate applications on 3 primary factors: impact, efficiency, and sustainability. Strong SiteFirst projects are planned by Lions in collaboration with partners, such as local eye hospitals, both Lions managed and non-Lions managed, or other NGOs. Strong projects are need-based and exhibit cost effectiveness, as well as include a plan for sustainability beyond the lifetime of the project. The technical advisor is available at the early stages of project development if you have any questions or need help, and regional program specialists like Danielle and I are available to review any concept notes or draft applications and provide you feedback on how to make your application stronger. When developing project targets, make sure you state them in numerical terms. Your outputs and targets must be SMART, that is specific, measurable, achievable, relevant, and time-bound. Here are some examples. As you can see, these are quantitative outputs for each of the 3 SiteFirst intervention areas. They can be written as numbers or percentages. Here are some tips. When increasing the number of surgeries or laser treatments, specify if these are cataract related, glaucoma, for diabetic retinopathy, or any other type of eye condition. When increasing the number of individuals screened during camps, specify the age group and camp location. The service delivery outputs table in the Site First grant application can help you create these targets. Just add them up and add them to the first output section on the first page of the application. Don't forget that you should also include quality outcome indicators. Staff is always recommended to help you create or refine your project targets. Most Site First grant applications involve infrastructure development activities such as renovations, facility expansions, or equipment acquisition. The application should be clear as to whether you are expanding the facility, such as building a new floor or repurposing an existing space, which could take the shape of converting an examination room into a laser treatment room. You should describe how the space was used before the renovation or conversion, and plans after the renovation. You should also give an estimated timeline for construction and equipment procurement and installation. Most importantly, please justify how this renovation or expansion will increase or improve your services. Use data as much as you can to support your explanation. It's also helpful if you include photos of the existing space and blueprints of the intended expansion. Budgets are scrutinized in detail by LCIF staff and the Site First Advisory Committee. The application form provides a link to a budget template, which is shown here, that can help you create a project budget. The examples provided in the first column are just that, examples. Please change them as needed. You can add or delete rows, whatever is necessary. Please specify which expenses will be covered by Lions, LCIF, or partners. You'll see that these are columns at the top of the Excel document, and they can be changed as needed. Don't also forget that the EQ Plus equipment, there's a whole section for EQ Plus, requires a local match of 50%. So the cost of the equipment should not only be in the LCIF column, it should be split at least 50-50. We also request that you group expenses by year, and this is facilitated by this Excel document, which is broken down by project years. This helps us gain a better understanding of the timeline and schedule of your activities, so that if the project is approved, we know if it's running on schedule or delayed. Also, break down cost per item. In this example, in the renovation expenses, you can see that it's broken down specifically into roofing, electrical installation, windows, and doors. You can change these as needed, but the more detail, the better. It's also important to justify the need of each expense. When doing so, consider these questions. How will this item improve or increase the eye care services? How will this item benefit the needs of the project area? Or how will this item help overcome barriers to eye care services in your area? You'll see that there's a column for justification explanations, and so please use this. Now I'll provide you with a few examples of approved Site First grants to give you an idea of the type of projects that are considered. This project for Nepal seeks to upgrade cataract, URE, and diabetic retinopathy services in Chitwan. This project includes all 3 service intervention areas, including infrastructure development, human resource capacity building, and service delivery. They wish to equip the Bharatpur Alliance Eye Hospital. And in terms of human resource training, they want to train ophthalmic students, fellows, medical residents, nurses, and paramedical staff. At the end of this project, the hope is that they will have provided 3,608 cataract surgeries, 3,856 diabetic retinopathy treatments, and increased school screenings to cover over 230 schools and 68,000 students. This project from Sri Lanka is in its final year of implementation and has continued even throughout the COVID-19 pandemic. The project seeks to upgrade comprehensive eye care services at the Lion Sight Center at the District General Hospital in Nuwalapitiya. This grant covers only 2 intervention areas, infrastructure development and service delivery. The approved project targets are listed on your screen. Thus far, the project's made significant strides in meeting its projected outputs. The project has screened over 24,000 children for refractive errors, and over 1,600 people have been operated on for cataract, and approximately 992 people were treated for diabetic retinopathy. Furthermore, 300 people have been diagnosed and treated for glaucoma. This project from Palestine is in its final year of implementation and has also continued throughout the COVID-19 pandemic. The project seeks to upgrade medical retina services with an emphasis on diabetic retinopathy care at St. John's Eye Hospital in East Jerusalem, as well as at 3 of its satellite hospitals in Hebron, Anabta, and Gaza. This project covers all 3 site-first intervention areas, so infrastructure, training, and screening. The approved project targets are listed on your screen. Thus far, the project's made significant advancements in meeting its projected outcomes. The hospital has already had over 2,500 medical retina patients and 2,000 vitreoretinal patients per year. Over 55 patients have received retinal surgery per year, and over 1,600 patients receive laser treatments annually. So, you've applied for a Site First or a diabetes grant, and you work with the regional program specialist and the TA to revise your application so that it meets criteria and will make a huge impact on your community. The SAC, or the Board of Trustees, reviews it and decides to approve it. So now what? Next, the regional program specialist will send you a grant notification email that includes the grant agreement, reporting documents, financial disbursement forms, and any other relevant materials. The project committee must now sign the grant agreement and return it to the regional program specialist and begin meeting any conditions placed upon the grant by the SAC or Board of Trustees, including raising matching funds. Once steps 3 and 4 are complete, the regional program specialist will send you the first disbursement and the project can start. 6 months later, the project committee must submit a narrative and a financial report. Both narrative and financial reports are required every 6 months, regardless if you need further grant funds or not. In the financial report, make sure you compare the expended project funds versus the approved project budget. You must also compare the achieved project outputs versus the approved project outputs. You will continue to submit narrative and financial reports that capture the overall achievements of the project throughout the course of its duration. At the time the final report is submitted, make sure it tells the cumulative story of the project, not just of the last 6 months. This will be the final report, so it must show the overall impact of the project. This timeline, this process is the same for both Site First and diabetes grants. There's no difference. The only difference is whether or not the matching funds need to be raised. Let's take a look at the reporting component a little bit more in depth for both GHI grants. As I said, you must submit narrative and financial reports every 6 months. Your financial reports for diabetes grants should be for the overall project budget. So that means for the LCIF grant funds as well as the local matching funds. You need to report on both. Bank statements must also be included for every project report. This is also how LCIF staff verifies that local matching funds have been raised. It would be helpful if you detail new matching funds raised in the narrative report, including the amount raised, date deposited, and origin of the funds, ensuring to specify whether it's from a club or a local partner. This helps us review the bank statement and better understand where the funds are coming from. Some of you might remember that Document C was used for reporting for Site First grants. This form has been retired since 2018 and replaced with the new Site First grant report form, which is pictured on the screen. Please submit your narrative reports according to this new template. Document C is no longer needed nor accepted. If you need this form, it's located on our website. Otherwise, please reach out to Danielle or myself and we can send it to you by email. Finally, please include any supplementary information needed in the reports. This includes output, or quality indicators, even if not officially approved project targets. It can also include details on training curriculum, photos, and anything else that would give us a more comprehensive view of your project achievements. I sincerely hope that this presentation provided you a detailed and informative overview of Global Health Initiative grant programs. For more information on our grants, you can email us or visit us on our website via the links on your screen. Whether you're interested in GHI grants or another LCIF grant program, I highly encourage you to check out the new online grants toolkit. The toolkit is a one-stop shop for both prospective applicants and current grantees. It includes resources such as tips for applying for a grant, tips for managing a grant, application forms, and so much more. Thank you for taking the time to learn more about the Global Health Initiative Department and our grant programs, and I hope you have a great time at the forum.